Good morning. It's very exciting to be here on the stage because it's so important. We waited so long time to bring some new elements by Johan, and also I would like to share some ideas about networking. I'm for 2 years now in this Alpha community, and I learned a lot of things, and I think it's very important to share, and I would like to give you some ideas. It's a little bit like a toolbox about the ideas how to build up a network in this association work, or how to go further if you have an organization which is running for a long time. So, of course, we know all these questions, how to start, how to grow, how to realize the priorities. And for me, network, of course, is a kind of communication, and the communication in my schema, in my thoughts, are on different levels. The first level is an alpha 1 communicate with other alpha 1s, and so, or he communicates with his doctors, and he is on a very individual, on a very personal level. He is integrated in his family, and the communication is always in the same manner, on the same level, which is not the second level. The second level might be the level of the association. The association of a patient organization can be established, or in the beginning, like we have it now in Switzerland, or perhaps also in the Lebanon, some patients, some doctors getting together to speak about the problem, to speak about the disease. And here on this schema, I would like to give you some ideas what I think it's important for an Alpha 1 patient organization to get in contact with. The most important point, I think, is to get in contact with Alpha-related other patient organization, like patient organization of rare diseases, of hemophilia, of immunodeficiency, because they are all concerned by plasma using, and so their kind of interest is very large, and we can share with these patient organizations the ideas. We can share also events or managing of something we would like to go together. Alpha 1 community is also part of the COPD community, and so I think the patient organization should always try to get in contact with other lung disease associations like sarcoidosis or even tuberculosis. And in the care-related way, also the alpha specialists in clinics should know that the group or the patient organization exists, and all these associations should be part of your network. If you go further to the politics, Ministry of Health, or people which are concerned about these, about reimbursement, about functions of the hospital, I think you should also get some contacts with these states. And last not least, of course, the pharma industry is very important, because they are doing the products we need, and also they can help us to go further with our ideas in the patient association. For me, the third level is also important, which is on the second level, of course, the association has an exchange with the elements. The elements is the Alpha 1 patient. The Alpha 1 patient brings up his motivation, his ideas, his personality, and his problems in the Alpha 1 patient organization, and we have a feedback, and these two levels are communicating. Why should we communicate with other patient organizations of other diseases? To look what they do, to share good ideas, to collaborate and work together, but also to learn. But As you know, if you are a patient organization, there are always associations which are bigger, which are older, which are further. They have more money or they have more patients. And I think every time we meet another structure, we can learn a lot of things. The third level, which is a little bit higher, is the European or the international or global level. Like Johan told us, PLUS, which is the association of the plasma users. And in the Alpha community, there is the Alpha 1 Foundation and also now Alpha 1 Global. And we are communicating with IPOPI, COPD Global, and also the World Hemophilia Consortium, which are mega structures, but very important, as we saw, to get the ideas and to know what is going on this level, what is going on, and they should be integrated in our networks. So all these three levels together give the elements to structure lists of association of people to contact. And there is a second approach for the Alpha 1 patient organization, which is a quite statistic approach, which is here, for example, you have the example of Europe. In Europe, we have 35 languages, we have 47 countries, but in the European Union, we have only 28 countries. Actually, in Europe, we have 13 patient organizations, 18 in the whole world, and the reimbursement is done in 10 countries, which is not very much for 47 countries. But I would like to show you that to interact with all these countries around in Europe it's very difficult because we have language problems. And to keep the conferences in English like we do is a good thing. But if we go a little bit further to Poland or to Minsk or in the Ukraine, or even in states nearer, it's very difficult to contact people in the same languages. So 35 languages in Europe is a language problem, so we have to translate. For example, a lot of communication and information papers of the foundation are translated in 9 languages, which we should use. And we see also every country has its own situation. In some country we have no structure, but we know some patients. In other countries, like Austria or Germany, we have a patient organization which is very rich, which functions well and has a lot of activity. So I think every country needs its own toolbox to go further, because we have to go further, because there are new informations. And a small organization should choose, of course, the priority to know what to go for awareness, for detection, or for access to care, because it is different to make known that you exist and that the disease exists. It's different in a system where you know there is health care and there is reimbursement. The second is you should know what are your key topics. I will say about that it's very important for the leaders of the patient organization to think about their disease and to write about their disease in one of the 35 languages, but also in English. They also should write their own story to get down the ideas, how it comes that they get motivated to be a leader and to go for this disease. Something about the association, so different text should be ready to get out in the network, which has to be established in a couple of months or a couple of years. So I think to build contacts, there are 2 lists. The first list are all the elements where people should know you, like, for example, public health service. They have no idea that the patient organization or that there are a groupment of patients who has to say something, or even, of course, you should get contact with the Rare Disease Organization, with the National Alpha Registry. They should know you. They should know that you exist, and you have to write, you have to phone, you have to go there. And the second list for me are the contacts you would like to make. And the contacts you would like to make are, for example, the pneumologist or the association of doctors or other institutions which are in healthcare, and you would like to contact them. What is the key message to get out? It's very important, of course, to get a newsletter, for example, 2 times a year, and to spread it out in your network. And I think it's better to do it on a paper sheet, on A4, than by an email message, because everything you would like to go for with a special message, it's better to keep the paper on the desk than to have it in the email list. Also, if it's possible to create event in the sense of to contact perhaps other associations with other diseases, and to make a day or a week about some disease event with other partners, it's very, very important. And here I give you an example, for example, a mailing we did to pneumologists in Belgium, and we did it in 2 languages. On the left side you have the French language, on the right side you have Flemish, because we have 3 national languages, but the German is very, very small, less important. And on the back side of the mailing, we have a fax to ask how many brochures would you like, how many leaflets in French or in English or in Flemish. And I also put my visit card in this kind of mailing. So we sent it out to 300 pneumologists, and we had a retour, a feedback of about 4 to 5 demands to get 10 to 50 leaflets in a special language, in a special hospital. And I think it was something I would like to show you. There are, of course, a lot of tools to create. And if you are a patient organization which is running, which is established, which has its own identity, the problems are, of course, not the same as a started patient organization. But the basic problems of all association means how to get new members, how to find volunteers, how to find the leaders, and how to find funding. If the running patient organization gets well, has found his funding, the question is always how to get new members, how to grow. To get new members means to grow the association, means to get more present on the scene. And the first thing to grow the number of members in your association, I think, is to approach the wider families. Because as an alpha, of course, you are integrated in your family system, and there you have to look and to ask them also to get members. And it's quite easy to bring up the number of your members when you go for wider families. Then you should intensify your network. As I told you before, video presentation is for me very important. Video presentation means, for example, a patient organization which is running well. You put on your website 2 or 3 very small videos of 1 minute, 1.5 minutes. One of the leader, for example, explains what he is, what he's doing in the association, and a second one, how the association is working, about the goals for all these things. And this is very important, this video contact, because if alphas are diagnosed and they don't know the association, if they have a look on the website, they would like to know what is going on, and if it's really important to be a member there. So I think video is a support which is very authentic and easy to make, and very important to present the association. Improve the availability of testing. That means you should be sure that if there are alphas out, and we know it's so underdiagnosed, that patients could be tested by specialists, by lung specialists, that the tests are in the country, and how also to measure the plasma level of alpha-1 antitrypsin. Marketing tools are tools to make known your ideas. Here you have a kind of leaflet, which are, a lot of them are around on the table, which is very important, so people can take something with them. I mean, it's basic stuff, but I think it's so important, and it's not done everywhere, and it should be updated, for example. And then here I will finish with first these two posters. These are small posters in A5. On the left side, it's from France, and Sandrine, she puts it to the cabinets, to the waiting room of the lung doctors or in the hospitals. And on the right side, you see the Australian poster, which is on internet, but also figures in a lot of hospitals in Austria. This is a very permanent approach, a kind of publicity to make your association known. If you go further, if you are an association which has magazines like here, Austria or Germany, you know there is a support, there is a function of the patient association which is on a very high level. And I think all the small and smaller patient organizations should get to try to this level. So my last slide is about a video campaign which the foundation did last November. John Walsh presented a video of 3.5 minutes about, I'm sorry I haven't heard it, about I'm an alpha, are you one? And after this video, he invited people to do the same thing, and you collected a couple of hundreds video, I think. And then there was a button which was distributed, and even today you can order it at the foundation because it's a very nice thing. Thank you, John. And this kind of campaign is really raising the awareness in a special way. So as summary, I think take the steps to open up your network. Of course, we will help you, Alpha-1 Global. We are structured to come to your country, to do things with you. We would like to do some pilot projects. We will talk about that a little bit later. And I thank you for your attention.